Welcome to an introduction to health on your time. Websites and apps like Uber, Home Advisor, and Indeed connect a consumer with a particular skill, expertise, or service. These companies are major market disruptors and have, in their own way, changed the way many consumers do business and access service. The common denominator with these companies is they connect consumers to services. Health on Your Time is the next great market disruptor. HOYT connects a consumer with a need, concern, or question concerning their health or a family member's health to an expert in healthcare. 3 experts in the field of healthcare delivery and technology have solved a problem for consumers trying to access the healthcare delivery system. HOYT provides a vehicle for people to address their medical problem in the moment that they are ready and on terms they are comfortable with by providing unprecedented and immediate virtual access to hundreds of medical disciplines and thousands of experts. An aging population, millennials that want immediate results, increasing chronic disease, the importance of self-care, high deductible insurance plans, health savings accounts, accelerating healthcare costs, an unhappy, unsatisfied healthcare provider, and regulatory demands are driving interest in a better healthcare delivery model. Health on Your Time technology provides a healthcare consumer, at a time of their choosing, the ability to enter a description of their medical problem, need, or service, and be presented a list of all HOYT experts that have self-identified as having expertise in those same areas. Like Uber, expert availability is fluid. Some HOYT experts are available on demand, while some are available on a scheduled basis. Using the HOYT technology, a healthcare consumer, after entering a search term, can compare expert profiles that include professional background, previous HOYT consumer experience ratings, expert availability, and cost for the HOYT service. The consumer chooses an expert they believe can resolve their concern. There is evidence that consumer issues in healthcare technology environment can be resolved 83% of the time from the first interaction. This is a cash transaction and there is no insurance and therefore no impediment to access. It's a very simple idea with robust technology support. As a connector, HOYT allows the consumer to choose the expert they believe will help them, and the expert can utilize his or her experience and knowledge in a way they have never been able to in the past. This connecting service removes the need for insurance coverage, approvals from a distant call center, and burdensome documentation. We believe that there's a place in the marketplace for timely, accurate, and consumer-driven healthcare solutions. The nation's experience with coronavirus has brought forward the notion that healthcare information and utilization can be performed in a technological way. HOYT is not telehealth with all of its insurance regulations and the need for a physician-driven model. Our technology, both web-based and through a mobile app, is easily used. As a self-identified expert in healthcare, we've made it simple to become part of our network of providers. It takes less than 15 minutes to complete the web-based application. After we have completed the vetting process, you'll become part of our network of experts and begin receiving requests from consumers. Once the consumer interaction is complete and the financial transaction is finished, the consumer will be asked to rate their experience, developing a personal satisfaction profile for each of our experts. This consumer-driven rating will drive both competition between experts and maintain a quality factor not found in healthcare services. Beyond just direct-to-consumers on the internet, we believe there is a marketplace for the HOYT technology for physician groups and their panel of patients and referral partners. We also think, as an employee benefit for corporations, the use of HOYT can drive down healthcare costs and improve productivity and efficiencies in the workplace. Additionally, vendors looking to promote their own products, medicine, and services could potentially use the app to connect with other vendors or our network of experts to make a timely and efficient connection. Companies in the healthcare space can join the network as a provider of services that will allow consumers easy access to these businesses, make a connection at a time convenient to the consumer, and potentially connect the consumer with the appropriate business. As with all websites and apps, there is always the anticipation that advertisers will be supporting the continuing development of software. We understand there are similar services online. However, the difference between HOYT and other services is that HOYT is consumer driven. Our consumers pick the expert of their choice at a time convenient to them. The other big differentiator is our ability to present to the consumer multiple self-identified experts that can manage the problem or need of the consumer, allowing the consumer to choose who they interact with. We do not limit our capabilities to a single issue or using just doctors and insurance-driven products.